Now we begin straight away with our top story. The number of COVID-19 cases surpassed the 20,000 mark after 723 new cases were confirmed on Friday, with 16 people succumbing to the virus over the last 24 hours. Health Cabinet Secretary Mutahi Kagwe appealing to young people to take the containment measures seriously, with statistics indicating that the fatalities include those aged under 40 years with no known pre-existing medical conditions. And with international flights set to resume tomorrow, Kagwe says the decision on what countries will be allowed into the country was based on science, with the aim of protecting the citizenry and not diplomatic considerations. Nancy Okware begins our bulletin.
The country is appearing to be sliding into the red zone fast, with the number of confirmed cases now past the 20,000 mark. On Friday, Health Cabinet Secretary Mutahi Kagwe confirmed 723 new cases out of 8,679 samples tested, pushing the COVID-19 caseload to 20,636.
We are simply saying, out of the samples that we tested, those are the positive cases. But practically, there is probably a lot more people in our community who are so infected. In fact, there are people who go around on Saturdays just looking for a wedding to attend. You know, you don't have to know the people. But there is a new normal. Now, we need to know, we have to contain it and be just a few people who are attending the wedding.
The number of fatalities also rose to 341 after 16 more people succumbed to the virus. The CS noting that the trend had changed, with many more young people without any pre-existing conditions now succumbing to the virus.
One lady amekufa akiwa na miaka 22. A young person, 22 years old. Vile katika Kiambu Level 5 Hospital, kuna mtu mmoja pia, mama moja pia amekufa akiwa na miaka 37.
Mutahi calling on the age group to be extra careful and adhere to the containment measures in place.
Usije ukafikiria ati kwa sababu wewe ni miaka 20 na kitu ati huwezi kuambukizwa ama huwezi kufa ukiambukizwa. Unaweza.
44 patients were discharged after making full recovery, out of which 24 were from the home-based care program and 20 from the various health facilities.
It is not entirely correct to say that those who have gone on home-based care have been abandoned, because we have community health volunteers spread out throughout the country.
And with the Kenyan airspace set to reopen tomorrow for international flights, the CS said that the decision to exclude some countries was purely based on scientific facts to avoid reopening up the country to imported COVID-19 cases from worst-hit destinations.
It's got nothing to do with the diplomatic relationships. What it has to do with is a health assessment and protecting Kenyans from what can easily become another another imported case of virus growth.
18 countries were given the green light to have access into the Kenyan airspace after 7 more countries, including United Kingdom, France, Netherlands, Qatar, UAE, Italy and USA, with the exception of California, Florida and Texas, were added to the list on Friday. With the number of fatalities resulting from COVID-19 having hit 341, the Ministry of Health is concerned following an increase in number of people succumbing to the virus without having any pre-existing condition, hence a clarion call to all Kenyans to keep adhering to the set out guidelines. Nancy Okware, Channel 1 News.